A belief that COVID-19 was a hoax or exaggerated led to 2.3 million people delaying or refusing to get the vaccine between March and November of 2021. That's according to a new report released by the Council of Canadian Academies today. The expert panel estimated that if those vaccinations had happened, there would have been approximately 198,000 fewer COVID cases, 13,000 fewer hospitalizations, and 2,800 fewer deaths from COVID in Canada. Misinformation being called a threat, especially to vulnerable communities that pay the biggest price for things that go wrong in our society. The chair of the panel, Alex Himmelfarb, says the actual impact of COVID-19 misinformation is likely much larger than the report findings show, because they only looked at a 9-month period during the pandemic, which has so far lasted for about 3 years. The study also didn't include estimated indirect costs and the ripple costs, such as delayed elective surgeries and treating long COVID cases. At any given time, those looking for opinions that match their own, however wrong they may be, can find it online. Hashtags like fake news often leading to a slew of claims and allegations that fuel distrust and conspiracies. The fake news movement, if you will, took off with former President Donald Trump.
No, I never discussed increasing it. I want it in perfect shape. That was just fake news by NBC.
I'm not going to give you a question.
Can you state categorically?
You are fake news.
Sir,
go ahead.
Can you state categorically?
I'm the president and you're fake news. And you know what I'll say to you? I'll say very nicely, I know you well. I know you well because I know the guy. I see what he writes. He's a total faker.
Take, for example, hashtag Pfizer that is trending on Twitter today. It's all because of a video that many online say shows a Pfizer representative talking about mutating COVID.
Pfizer ultimately is thinking about mutating COVID?
Well, that is not what we say to the public. No, don't tell anyone this. You probably shouldn't tell anyone. You probably shouldn't tell anyone. Okay? We're exploring, now, you know how the virus keeps mutating?
Yeah.
Well, one of the things we're exploring is, why don't we just mutate it ourselves so we could create unfavorably develop new vaccines, right? So we have to do that. If we're going to do that, though, there's a risk of, as you could imagine, no one wants to be having a pharma company mutating viruses. It be, very controlled to make sure that this virus that you mutate doesn't create something that, goes everywhere.
On its face, it may seem shocking, but it has not been verified, and the context is not clear. A Google search of the man's name brings up a warning, telling people that the search results are changing quickly and to check the source on the topic. A World Health Organization committee is meeting tomorrow to consider whether the COVID-19 pandemic is still a global emergency, 3 years after it was first declared. The HWO saying whatever the committee decides, the virus is still causing deaths and pain worldwide.
Since the beginning of December, the number of weekly reported deaths from COVID-19 has been increasing. In total, in the past 8 weeks, more than 170,000 people have died of COVID-19. That's just reported deaths. The actual number of deaths is much higher. Do not underestimate this virus. It has and will continue to surprise us, and it will continue to kill, unless we do more to get health tools to people that need them and to comprehensively tackle misinformation.